3 years ago this April, I was appointed the head of the Ruminant Animal Health Division. That's the lead policy division on TB. We deal with the scientific input into the TB eradication program and oversee that. So that's how I've been 3 years in this position. I'm acutely aware that causation and association. I know the difference between those, thankfully, because my joining this role, I'd like to think, is not directly related to the increase in disease prevalence.
We know that, Damien. No worries about that. We definitely know that. We've listened to 3 interviews there from the experience that people have had in the UK, and they obviously had a serious issue there that really, in a way, started for them after foot and mouth, and their situation got very, very bad. And fortunately, some of them definitely seem to be turning a bit of a corner. But unfortunately, here in Ireland, we're not in a great place, and the situation has got worse. Do you want to speculate as to why we possibly in a worse situation now than we were, say, 10 years ago?
I think the demographics of the Irish cattle population have changed a lot in the last 10 years. We've seen quite a change from small scale traditional sucklers. There's been a reduction in those type of operations and an increase in larger type, more intensive dairying operations. Now, I just to be clear, this isn't a reflection of increased susceptibility or anything like that among dairy farmers, but it's more that where you get that among dairy cattle, rather, where you get that increase in herd size, you are, as you're aware from several other diseases, where there is an increase in herd size, there is an increase in the number of susceptible animals in a herd, and herd size is a feature of disease transmission for all diseases. But there's a couple of other things that came along with this as well, is that there was quite a significant movement or change in the movement of cattle from areas into areas where there hadn't historically been TB. And that might be something akin to what happened in the UK after foot and mouth, where areas were repopulated and cattle were moving from areas of a higher incidence into areas of a lower incidence. I think we've also seen that the disease level, the background disease level in what we'd call factory lesion cattle has been rising at a steady pace since 2019 at about 13-14% per annum. So we've seen the disease level rise in the background, and the number of skin reactors was not keeping pace with that until 2023, particularly. And we also saw a concern in particular was that we saw herd incidence fall in 2022, although reactor numbers were rising, which led us to believe that detection levels in conjunction with this background risk were not keeping a pace. So I think we could possibly have had seen a perfect storm in terms of disease epidemiology, which is now leading to the higher incidence and the bigger breakdowns.
This is where we are. So we've now got to look at how can we get this under control. So, I mean, we can't wash our hands here. We've got to change things and look at things. I mean, that first interview we heard from James Woods, and he's talking about sensitivity of testing, and you're highlighting the fact that the skin test isn't particularly sensitive. Certainly as a practitioner, when I was in practice, and as many practitioners have been in a situation where we've been encouraged or lent on to squeeze a bit harder, but actually false positives isn't really the problem. It's the false negatives. What we're leaving behind is more of an issue than what we're taking.
Yeah, very much so. The reason why we use the skin test is that it's got a very high specificity, which in layman's language means it has very few false positives. And along with that, you have a sensitivity that's going to be no more than 80% in perfect circumstances when the test is done to a very high standard. And then the danger with that is that, say, for instance, there was a study from University of Cambridge there a couple of years ago, and it showed that half of recurrent breakdowns were due to residual infection, and half of those in turn was due to the presence of one animal being left behind. So, there's a narrative particularly, and Brendan alluded to this with the NVLs, that they're a rod for people's back. In NVL, with a test of this high specificity, most of the animals are actually infected. And an NVL means the disease has been detected earlier on. A high lesion rate, while it might give a farmer comfort in one sense. It actually means that the disease is well established in the herd, and it's going to take quite some time, a lot of tests to actually rid or eliminate it from the herd.
And I think that NBL situation, we've all felt that when we've all, had farmers giving out to us yards on that one. So we need to sort of change the language there. Again, James was talking about targeting who we test, as in the sense that using the gamma interferon test, but you can't just do that on a blanket basis. But again, it's going back and looking at old, other animals in the same cohort, older animals. Is that where we need to be moving? This isn't going to be solved by one silver bullet. There's a whole lot of pieces, aren't there?
Oh, this is a classic game of inches. I think you were talking about Munster rugby earlier on, but TB is a bit like scrummaging on your own try line, trying to keep the ball out. There's no dainty back that's going to run up the length of the field and score a try for you here. This is scrummaging on your own try line. Gamma interferon is one element of this. Like, the beauty of the gamma interferon testing is that the sensitivity is substantially, is higher. It's of the order 90% plus, but you're paying the price of lower specificity there. You're willing to pay that price where you apply it, where there is cattle to cattle transmission, and where there may be there's a greater chance of taking out some false positives. But this is a price that has to be paid in the context of ridding the disease out of a herd, where it's in the cattle to cattle transmission type scenarios where we suspected that it's applied, and it's usually applied to the infected cohort, not applied to the entire herd, so that it's targeted where it's going to be the most effective.
Well, it's interesting listening to Brendan talking about the Pembrokeshire project, because he's obviously got an enthusiastic cohort of farmers there who, once they get their results, they're very keen to actually, when they're making culling decisions, they're not just on high cell count and lame cows. They're also, is she a cohort of that one? It's quite obvious they've got a different mindset as to how they're going about culling animals. And in fairness, with ICBF here now, we haven't talked about breeding yet, but I mean, people can make decisions again about breeding here too, where there is evidence that we can help there as well. If we could get people's mindsets to change, now there's a lot of mindsets we need to change, but that's something we need to be aware of as well, isn't it?
That Pembrokeshire project is very interesting, and this risk rating system that they speak about, we've had similar experience here looking at historic skin readings, and we've taken out some animals with high previous bovine readings that were parts of infected cohorts, and quite a few lesions have been detected in these animals. So these animals could be the long-standing infected animals that were the source of infection, spreading it to others that were going undetected. But the key to this is actually accurate historic skin readings. And it's very important that all bumps are measured and that we have them there. And we are trying to develop a system of analysing that as well, so that these animals can be identified. And the wish is that we can advise farmers in future that these animals should be on the cull list. These animals, well, they won't be qualifying for compensation, but I think people need to get a bit more mature about this, to be a bit more proactive and not necessarily wait for the compensation to make decisions to protect their own herds.
James was highlighting that obviously, I think their contracts are slightly different, but obviously when you get a TB outbreak in the UK, you get penalised because you're not producing enough milk for what you said you'd be producing. And so they desperately go around trying to search to buy in. And of course, that's one thing. With the closed herd is a much better situation to be in. But if you get forced down that route, it's like any infectious disease. And I remember the very first time I ever met you was actually, we were talking about mastitis and high cell counts. And that's many years ago. You possibly don't want to remember how many years ago, Damien. But I've found over the years that it is easier if you've got high fertility and you've got plenty of replacements. It's easier to make these decisions. And maybe that's where we all need to be getting to, not worrying about compensation, but making the right decisions for the herd.
And there's a few other things playing into this as well, that there seems to be a bit of a merry-go-round. When people are restricted, then they go clear, and then they may well go sell cows for milk. Lo and behold, someone else comes and buys them, and lo and behold, a few months later, there's a breakdown in that herd. Like, people need, when they are buying cows, they need to be very cognizant of what they're buying. And they need to be aware of the disease history certainly ask what the disease history of the herd from which they're buying is. And because these animals are the engines of their business. Like, we have evidence, Miriam Casey is conducting research in UCD on residual infection. And something that's going to come out of that will be that animals have a longer residency, like cows, breeding animals, they carry the greater risk. So if somebody's going out to buy cows, they need to mitigate that risk and reduce it as much as possible in where they source them. Ideally breed them themselves. I suppose one of the unintended consequences of sex semen is that there's probably a reduction in the number of heifers on farm at the moment, and it could well be creating a bit of a scarcity. But like, I think we need to be a bit more cognizant of ideally breeding from within, but if not breeding from within, or purchasing from people with good TB histories. You also mentioned breeding there, and that's something that I must admit, when I came into this job, I was a bit skeptical about the role of genetics in the eradication of TB. But when it was shown to me that of the top 20, the most popular dairy bulls in the country, there was well over half of those with inferior TB resistance figures. That really made me sit up and think that we need to bring genetics into this as well and increase the resistance. And it also made me think that if there was one or two bulls on that available for AI that had poor resistance, high susceptibility to TB, then those bulls through AI could create quite a bit of susceptibility in the population and could be a risk for bigger breakdowns.
Yeah, it's just something else we need to consider. But talking about the historical TB, and Sarah was very much about the IPTB map that they've got in the UK, apparently they've got 10 years of residual data there. Sorry, in my ignorance, what's available to a farmer now going out and buying cattle? How easy is it for them to see what the herd's like?
Well, unfortunately, for a variety of reasons, that information isn't as readily available here. However, any herd owner can go onto the Ag Food portal and go onto his AHCS section there, and he can print off what his herd status is, whether it's C1, C10. It's up to C10. C10 means the herd has been free of TB for 10 years or more, and so on. Farmers doing the buy-in need to ask the question. Unfortunately, at the moment, it's a question of buyer beware. We've made efforts to make this more publicly available, but we were met with considerable resistance by stakeholders. And but it is something that we feel that farmers buying cattle, particularly breeding cattle, they're going to be around for the long haul. That this is information people need to know.
Yeah, that's interesting. I mean, I would say, as Sarah was sitting on this conversation at the moment, she'd be saying it's a no-brainer that we should be doing something like that. And I know that one of her big things is don't worry about the things you can't control the controllables. And in a way, quite a lot of what she was talking about the badger, and we can't ignore the badger because the badger could seed it. But on the other hand, we can't blame the badger for everything. No one defends the badger. Do you understand me? I mean, if we can just talk about it, him and a tiny bit, or them a tiny bit, because I mean, they are around. But then interesting again, listen to Brendan talking about roadkill and the fact that they have this system of picking them up and checking them. And if you've got an area where you haven't had a badger with lesions within 10 miles, then obviously badgers aren't really your problem. And in fact, you've got to worry more about what you're buying in. But even if you've gone clear, as we were talking off there, you could be clear. And let's just say, for the sake of argument, you were genuinely clear. As in, I don't mean just clear from the test that you're free of TB. But if a month later, an animal gets infected by a badger, we've now got one animal standing in a herd, say, of 150 cows. That's going to start to spread, isn't it?
Yes, it is. Like, badgers tend to, certainly in certain sections, they receive all the blame. Our infectious disease modelling project carried out in the University of Wageningen would suggest, based on the mathematics and modelling, that about 1/3 of breakdowns are due to badgers and 2/3 due to cattle-to-cattle transmission. If the disease is introduced, though, once the cattle-to-cattle transmission is much greater than the badger-to-cattle transmission. One UK study would suggest that cattle-to-cattle transmission is about 17 times that of badger-to-cattle. So essentially what you're looking at here is that the disease may be introduced, and we might liken, if we look at this as a fire, the badger-to-cattle transmission, that event might be like a zip firelighter, and cattle-to-cattle transmission is like pouring petrol onto the fire. it'll just take off. Granted, it's important if we can take actions to avoid that introduction. And what farmers can do about that would be the like of fencing offsets, the like of raising water troughs to prevent access, avoiding feeding concentrates on the ground or in low troughs, use raised troughs, fence off yards, particularly materials like feedstuffs like beet and maize. They're very, very popular. But like the other thing we have to ask here as well in this context, we're looking at TB in a two-host system, and the badger is susceptible to the TB as the cattle. And if cattle may well introduce TB to an area that's free, introduce to the badger, and that then is introduced to other herds. So like we need to be looking at the two-host system. We also, like from our point of view in the department, like I've said what farmers can do. The department has got a wildlife program which consists of combination of culling and vaccination to mitigate that risk. But again, our research from the University of Wageningen has shown that our current approach between the tested and removal of infected cattle and our vaccination and culling programs is not sufficient to eradicate TB. So we need to put in extra controls, and it comes back to the previous thing here. There's no silver bullet. It's all about doing a whole lot of small things well, rather than one big eureka moment. And that's very difficult to maintain that discipline to keep all those balls in the air, plates in the air all of the time.
Yeah. I think it's interesting because Sarah obviously is spending time talking to people about practical things they can do about reducing the badger to bovine contact, which is true. But then you've also got to recognize that, okay, badgers travel a long way, but an animal that's carted from one end of Ireland or one side of the county to another travels even further. So, it's going to move around more that way. To wrap up, Damien, if you were to say, give me 3 key things that you want to sort of put out there to practitioners who might be listening to this, what were the sort of 3 things that you'd hope that they might take away from this?
I think the first thing, I think practitioners are in a have a very important role in the TB program, which I know when I was actually testing cattle myself, I didn't appreciate myself, and I think a lot don't. The first of those is the early detection of infected cattle, and that's good quality testing is key here. We need to identify and remove infected cattle sooner rather than later, and the other thing that goes along with that is these little bumps in terms of the bovine reactions. They may not look important today, but they may be important 2 and 3 years time. So we need to get that data as well, and we need to be feeding that back to farmers over time. We need to build that database up, so we're dependent on you for that. The other thing I think that's very important is that in your crush side conversations, and I know a lot of those are going to be about rugby and football and hurling, but maybe take the opportunity as well to talk about TB risk mitigation and what that means in terms of, say, how to reduce that contact between badgers and cattle. And the other thing then as well is the purchasing decisions on that. And we are trying to support people in this through the TB tasers. This has been a slow boil on our behalf. We want to get this, roll it out further so that we can actually involve practitioners in providing the biosecurity advice to prevent TB transmission.